bro.
Yep. Nothing's nothing's registering.
No, we
Oh,
are
there.
live.
Yep.
We are live on a beautiful Monday night. Ah, bro, nice. I like your thing.
Yep.
I like your thing, man. Hello, everybody. Welcome to Facebook Live with Mel Charlie on this wonderful Monday night, January 4th already, man. Bro, we jeez. Christmas right around the corner, bro.
Yep.
Christmas right around the corner.
Yep. If we Back to the Future, yeah. If we go in that direction.
Hello, bro. How you doing, man? How was your day today?
Was just very long and drawn out, and hopefully, was kind of warm today. But was just catching up on some work. You know, it's just every day there's always a new twist in life. So all I can do is smile.
I
Just
gotta be honest, man. I just hate this so much. You're right, bro. It's every day, every day. There's more news. What's up, Roland? All the way from Houston. I sorry, I don't mean to leave everybody else out, but when I see somebody coming from Texas, I would definitely give them a shout out. Aloha, I appreciate all you guys coming on. We really do. But every day, if it's not, England locking down their country, variant being found in New York, and I have a couple of stories, a couple of things I want to mention tonight from our viewers that have messaged me and give me permission to share the story about New York. Listening to the lieutenant governor in the morning assuring us that everything is all right, and then listening to Tyler Gomes from DHHL saying that the casino is the only way they're gonna get out of their mess that they're in. And I mean, it's like every stinking day, um, it's just drama in our little state of Hawaii, and it gets old, Charlie. It gets old, and I knew 2021 wasn't gonna be much different from 2020 in the beginning. It's gonna be a while. Now I listen to the news tonight, and I'm hearing these guys saying, we're not getting the vaccines out quick enough, and they're talking about splitting the doses now, so giving people half a dose, which wasn't tested. We didn't test half a dose. They figured that, they think that they'll have enough immunities built up in half a dose, but we can get double the amount of people. These when I watch these things, man, I just cannot help but get frustrated. Like, who the hell are you now to say that we only need half a dose? So what are you guys saying? That we overdosing people?
no,
Oh, we talking about just halving the dose for the younger people. Well, listen,
no.
man, it's
Half
just
of
it
those,
drives.
they're what they're referring to, because doses, when you look at the dosages, right? If you're gonna half a dose someone, that means that the person cannot be no more than 4 feet 5. Then they get half a dose at that point. So the thing not too strong. Now, if you 6'8", yeah, you take a full dose. Heaven forbid you 7 feet.
You know, I, it's just guys. I mean, I don't know. I just don't know. But I know one thing. I know one thing that this thing is. I watched Dr. Wong today. Doc Wong, and he's had it too. I mean, he's tired of people
Hey, Uncle
minimizing
Billy.
it. Yeah, he's
Hey, Uncle.
he's f you, Uncle Billy. That's what I saw. That was kind of the thread today. F you, Uncle Billy, and
Yep.
Auntie Nancy. I mean, but you see, I don't know if you watched today's one, but he's just over it. He's over the stupidity of people that refuse to believe that this virus is real and that it's killing a lot of people. And I gotta agree with him, man. I gotta agree with him. So I just, yeah, Dr. Fauci said no to the partial dosing. I didn't see that, but I cannot imagine how it would be okay. I mean, what the hell are we doing? I mean, we just,
Well, put it this way. Just remember now, when the emergency use authorization was given for the vaccine to roll out, right? It was under these parameters that it was done during the studies of the limited amount of participants, right? And they were given first dose and then a second dose at whatever percentage it was. That is what went on paper. That is what was submitted to the FDA. That is what must be adhered to. It cannot be altered after that. I don't know how they're going to do it.
Uh, exactly.
I don't know.
Exactly. I mean, it's the bait and switch. Like, we just want to check the box. We don't give a damn if it works or it doesn't work. Let's go give a whole bunch of people, millions of people, the false hope that they're fully immunized. Now, the one thing, again, that we have been saying for a while, and Dr. Vong made it very clear today, this vaccine doesn't protect you from catching the virus, it doesn't protect you from spreading the virus. It only minimizes the sickness. That's all. That is all. So, I don't hear that being spread out in our country. No, I hear about get your vaccine, get your vaccine, get your vaccine. You hear the lieutenant governor saying, I'm immune. I got my vaccine. I'm immune. No, you're not immune, lieutenant governor. You're not immune. You can still catch it. You can still pass it, even if you already had the virus. So, listen, guys, I don't know how else to get this message across. Obviously, we're preaching to the choir here, Charlie, on our show. Most of the ones that
Well,
disagree with us, they
let me
can.
read this to you, brother. And this is straight out of the CDC. I put it in my post today, about 5 hours ago. It typically takes a few weeks for the body to produce T lymphocytes and B lymphocytes. It's a T and B cells, right? After vaccination. Therefore, it is possible that a person could be infected with the virus that causes COVID-19 just before or just after vaccination and then get sick because the vaccine did not have enough time to provide protection. It's coming from the CDC.
Yeah. Well, I mean, we heard it from Dr. Kim,
Dr. Kim?
Dr. Jerome
Yeah.
Kim. I mean, he did. Anyway, we heard it from enough people,
Well, that's from the
but
CDC,
yeah,
that's from the CDC. But I think the lieutenant governor is getting his from the other agency, the BVD. I think he got it from the BVD, what he's talking about.
yeah. I just, why would you want to pass on information that could endanger people to make yourself look good, to make our state look good? Did you see the report today, the article that came out today that we're number 4 in the country on the infectiousness of the virus here in Hawaii, number 4. We're right behind New York. We're number
Yeah.
4, people. But no, we just keep on keeping on. I mean, I just don't get it. The problem is we're in a time where our numbers are so like the lieutenant governor says, manageable. Okay, so what? You celebrate and you party and I saw the video of that drumming party out there in Maui with that one naked dude running around with his balls hanging out. I can't believe, where the hell are the cops on Maui? You cannot tell me that no one knew about that. And trust me, I love my brothers and sisters in blue, but that's the kinds of events that's going to cause problems. I mean, that is. And I see that
You
video
know,
and it just blows my mind.
anybody want around bare balls like that, brother? I get the urge to take out one slingshot and just try, see if I can whack one of his nuggets while they're on the run.
Yeah,
Like that kind of Fernandez Fun Factory.
yeah, yeah. Nancy Budd is asking, why are we loosening restrictions to travel on Kauai now? Unfortunately, when the request went in, it was before all of these craziness started. I'm not sure what the mayor is going to do now. I got a lot of questions today, and I know Charlie, I'll let you explain because you got it straight from Mike DeHelig's mouth. But
Yeah.
um, there's a lot of confusion. But Charlie's going to make it very clear for you guys tonight on what the travel policy for Kauai is, and we'll give it a few minutes, make sure everybody's on. But um, it's confusing if you just watch that 30-second clip on the news. It's not so confusing if you took the time or take the time to watch the mayor's uh, daily update. He explains it very well. But the question remains: is it, what is it going to make a safer place for Kauai? Again, I don't know with the information and news on the variant and the infectiousness here in Hawaii. I don't know if the mayor would have put those requests in had he known. I just don't. And, he's trying to balance out the economy and health, but right now with this variant, I think everybody gotta reassess. I think everybody's got to reassess and
Yeah.
make sure we do what is the safest. Because, and again, I'll read a letter later from New York. But why don't we start off with that? Oh, what I wanted to start off with, there was Kauai Pediatrics that um, came out with a post about a patient that had just traveled from the mainland and had tested positive. And this doctor had got the permission from the patient to post on their public Facebook page, the flight numbers of the two flights that they were on coming to Kauai.
Hmm.
Well, that is very responsible of Kauai Pediatrics and Dr. Lamb, and it's very responsible for the person, the patient. But what I saw was a lot of negative posts about this person that traveled to Kauai from the mainland. And the only reason I'm bringing this up is because I know the family, and there's always circumstances, right? And I am one that says you shouldn't travel unless you absolutely have to. I I bark loud about that no one should be traveling for recreation right now. But I just want to let the public know that that patient came to Kauai because they're uh, now I would have to go pull my post back, but either the father or the mother had 90 days to live.
Mm.
That was the reason that person flew to Kauai, not to visit family. He came because a very close family member uh, was very close to death, and that is why that person traveled. Um, would I travel if my loved one, my family member was sick? Absolutely. If that was the only opportunity, I would. Oh, Kapa'a Pediatrics. I'm sorry, I said Kauai Pediatrics. Kapa'a Pediatrics, Dr. Lamb. Um, but yeah, so I just wanted to clarify that because, oftentimes when the emotion gets hot, and I'm guilty of it as well, we post things without knowing the complete story. So I just wanted to clarify that. The family had asked me, without mentioning names, of course, but that was the purpose. And I just want to say that the it was very responsible for both the doctor and the patient to allow that information to be put out on Facebook to advise people in the event they were or someone they knew was on those flights that they should be careful. So I thank the family for doing that. Thank the Kappa Pediatrics for doing that as well. That information should be released from the government, from the whether it's the CDC who does the travel contact tracing, or whether it's the government, the state Department of Health. But that information should be put out to everybody for every case without mentioning names. That's what I think. So anyway, I just wanted to put that out, Charlie, because I thought it was kind of unfair, and the criticism was hurtful and definitely not deserved, not with those circumstances.
Hmm.
So anyway, so Charlie, did you want to tackle the quarantine, Kauai quarantine or Kauai travel policy? Why don't we start off with the inner island? We're back in the Safe Travels program on the inner island.
Well, why don't I wrap the whole thing so I'll take it in succession so I can mirror the two and then you can see what I am talking about. But first of all, and this in no way reflects on anyone's negligence of what's becoming, because again, like you said, no one knew about the variant. Uh, you know, Kauai has been really up against a uphill battle with the governor. He's made it perfectly clear, and let's take it back one step. We did have Dr. Miskovich on. We did understand, what's the difference? You asked them the question, what's the difference between Kauai and the Big Island? Because it was always a known fact that the governor never wanted the Trans-Pacific traveler, mainly our visitors, to be tacked on with any additional charges for testing. I mean, he made it perfectly clear. And that's why he put up those roadblocks in front of Mayor Derek Kawakami. So Derek had to, in his wisdom, had to use every avenue possible to get us as close to possible a strategic position to trap this virus for travelers coming into Kauai. So having said that, let's talk about when you come to the state of Hawaii. When you come into the state of Hawaii, travelers are required to, and now I don't know if it's for both inter-island and trans-Pacific. I forgot to ask that question. But I know one of the two, or if it's for both. The trusted, tested partners have been relaxed. That's the thing that I'm kind of worried about, but it's been relaxed. So as long as it comes from a reputable physician who uses a reputable lab. And you remember before when we first started, it had to be a PCR test, one of those nucleic tests, right? PCR. Well, now it can be a rapid antigen test. So that, I'm going to dig into that more because it just doesn't make sense. Well, I can see why, because some of the people that's on that trust, or some of the people that have taken the test coming from the mainland have ordered one of those tests where they send it to your house. That has to be a rapid antigen test. I don't think that's a standardized PCR test. So having said that, 72 hours prior to, you can no longer come with no test. If you come to Hawaii with no test, even if your test comes after, you trigger the 10-day quarantine period. No ifs, ands, or buts. Okay. So for travelers, if you want to avoid that, you can come into Hawaii. Just make sure you have the hard copy. Just make sure you have the hard copy of wherever you took the test to show the officials at the airport. Okay. That's Trans-Pacific travel. So far, so good. Everyone understands. Okay. So there is no second test. You take the 72-hour test. If you're negative, boom, you're free to go. You come into Hawaii. Now, coming straight into Kauai is a different story, Trans-Pacific, because you take a 72-hour test, you land in Kauai, whether you upload or you have that hard piece of paper, the one that will be responsible for policing that will actually be the resort bubble, because we have that resort bubble, right? On Kauai. Person goes to the hotel, he shows the front desk that I have a negative test result. That allows that person to check into the resort bubble for 3 days, right? After 3 days, the person takes a test, and if he comes out with a second negative test, he's out of that resort bubble restriction, and he's free to do whatever he wants on Kauai. Okay. Now, if you are a returning resident from Kauai and you fly directly into Kauai, you cannot go to your home and do your 3 days. You have to go to a resort bubble. And the reason that is because there cannot be a discrimination between a traveler and a resident. So they make it all together. So if I'm coming back from the mainland and I come to Kauai, I must go straight to a resort bubble, stay there for 3 days, take my second test, and get out. Now, here's where the catch comes in. If you were a betting person, play on words, I'm not talking about casinos now. If you're a betting person, I come back from the mainland after bringing my child back. I take a test 72 hours prior to, right? I would fly to an island that there's no quarantine if I got the 72-hour test. So I fly into Oahu. Because under the inter-island travel, you have to prove that you've been on the island 3 days or more to apply travel to come to Kauai, right? Inter-island.
Mhm.
So the day you land, if it was me, I would fly in from the mainland, land on Oahu, immediately take a 72-hour test in 3 days. Go find a place that I paid 89, like by the airport. You got one of the like Holiday Inn by the airport, right? Best Western. Pay $89 a day. Why should I come to Kauai and pay for the bubble and pay $400-500? Doesn't make sense, right? So I pay, stay Oahu 3 days. I take another test to come to Kauai. I show the people at the airport into island travel, right? I got one test, bingo. I bypassed the 10-day quarantine. So as you can see, there is the only time a second test will be required on the back end, which we discuss on how to catch these viruses, is when you're in a resort bubble to get out of the resort bubble. You take the second test. If not, that second test allows you to get on a plane to land, and with a negative test, and on top of that, the, as long as you go to a professional, whether it's a doctor's office or what, to take the test, and you've got like an official paperwork that's saying you are negative, you're cleared to go. That is the way that it was explained to me, and that's the way. So again, if you Akamai, the long way around this is you fly into Kauai, you're gonna be paying some bucks staying at a resort bubble, whether you a guest or a local. It's better off you fly to Oahu, spend your 3 days there, and then fly to Kauai. Now, I'm not saying this to get away from the system. It'll probably serve its purpose one way or the other, but either way, because there's no back end catching, once you get to the airport and you fly to Kauai, there's no back end catching of possible infections at the airport. And we talked about that before, right? So basically, what we're seeing, something similar to what's happening with this plan, is what Maui is going through right now. And I don't know how much, I know they have a cluster at Harbor Lights. They talked about it before, but I don't know how much is travel related too, see? So the only one that
Mayor Victorino, today's report said 17% of the cases were travel related. Maui.
yeah. So Keala, yes. Returning residents from the mainland, this is for Kauai. I don't know how it applies to the Big Island, but I'm just saying for Kauai, inter-island travel. They come to Kauai, they have to go to a resort bubble. They cannot go straight to their home. Unless you've been in a state for 3 days or more, then you can have that 72-hour test, show it at the airport, and you can bypass quarantine completely.
Just wanted to clarify that on the Safe Travel Program, not talking about the bubble, but the Safe Travel Program, you still need to get your tests from a trusted partner. If for the visitors or I guess returning residents that are utilizing the resort bubble, that is not required. You can just go get a test from anybody that's certified, and it'll be the hotel that determines whether or not your test is valid. So the government is not participating other than
Yeah.
making setting up the rule. And
Well, let me
that 72 hours is critical.
Yeah, Sarah Blaine, the chief of staff, just mentioned tests cannot be taken until you're in state 72 hours. Okay, you're in state for 72 hours. So what she's saying is you stay on Oahu for 3 days, 72 hours. It has to be 3 days apart. But because of these trusted partners with this rapid antigen test, because you're not barred from, because before you could only take a PCR test, which took a couple of days to get a result back, right? With the rapid antigen, you can get them back in 15 minutes. So you can actually take the test on that day and get a result on that day and come home, come to Kauai.
Yeah, if you can find one, remember the inner island now is still the trusted partner. You still got to use a trusted partner because
No,
you're back in a safe travel program. Yeah, on
no,
if you're coming inner island, let's say you're from the mainland, you get to Honolulu and you wait your 3 days and you want to utilize the safe travel program to come to Kauai,
mm,
that test, because you're not going to the bubble, that test is got to be a trusted partner.
okay, let me go clarify that because that's not what I understood. I mean, that's not what I understood.
Maybe Sarah can, maybe I know
Yeah,
Sarah's
Sarah,
watching.
can you let us, I know you're watching us, but can you tell us for inter-island whether or not we can use anyone outside of the trusted tested partners? Because then that will make a difference.
Yeah. So
So in the
yeah,
meantime,
that's what I had heard that, or that's what I read that the inner island component is still part of the safe travels now. So the Trans-Pacific, we opted out. The mayor got the approval to opt out, so that's where the resort bubble program came in.
Mhm.
But he also requested that we opt back into the safe travel program for inner island, and that would require the. So we'll see. Oh, there's Sarah.
okay.
So I'm not sure who's on the list anymore. I thought that CVS had pulled out. I'm not sure if Dr. T's on, but so we'll see. We'll see. That second test will, you hope that it's going to be sufficient. But it's definitely uh, it's a little inconvenient if that is the ultimate goal of the visitor is to get to Kauai through that roundabout way. But it's a hell of a lot cheaper than being staying at a resort bubble because the bubble hotels are quite expensive.
Well, my son wanted to come back. They wanted to come back. They said, Dad, I ain't staying at no resort bubble. Plain and simple.
I think the minimum it's about $1,500 to cover your 3 days. So it's gonna be rough. It's gonna be rough.
Yeah. So I'm sorry for confusing anyone, but Mel, you know what I did talk to, and I'm gonna listen to it again. But you know what I'm saying, right? I
Yeah.
just want to be accurate for everybody. Don't shoot the messenger. Don't shoot the messenger because I will crack back if you want to shoot the messenger. But I'm just saying, please don't shoot the messenger.
Rhonda is asking, can someone fly to Kauai with, I'm assuming, without taking a test? Yeah, you don't have to take a
Yeah.
test. You just quarantine at home. Yeah, all what we're talking about is just to get you out of quarantine. So if you don't want to take the test, if you don't want to take or go stay at a resort bubble, then you just stay at home, but you got to quarantine for 10 days. Uh, so that's how it works. Okay, hold on. Sarah is saying if you're flying direct to an EMQ, which is a resort bubble, then you can take any PCR or antigen test approved. Yeah, there you go. That's
Yeah.
what you were saying. That's exactly what Charlie was saying. Yeah.
Mm-hmm.
Yeah. So yeah, you can just go get any approved test. And again, that would be like Dr. T. You can walk into Dr. T's office and get an antigen result in 15 minutes. But remember now, that is what they're doing on the Big Island, Charlie. They're doing the antigen test on the Big Island upon every arrival. And you heard Dr. Miskovich, about
60%.
50, about 50% of those tests are false positives. So it's not really that's what I don't understand because everybody you talk to, Charlie, the test that they're talking about is 96, 98% accurate, including the one they were giving it on the Big Island. And then all of a sudden you find out that it's only 50% accurate. That's
This is
crazy.
no. This is what I think. I think the manufacturer will tell you it's in the high 90s. so they can make the sale, right? Doesn't that sound plausible? I
Yeah.
want to sell maybe $1 million worth of test kits to Kauai. It's 99%. Then once you get them, how you gonna ask for a refund if the bug only in about the 50% rate? What you gonna do? They're gonna tell you show proof. Cannot. Why? Because get Hanabata on the stuff already. You cannot reuse it. What you gonna do, right?
Yeah.
That's where everything all jam up.
Okay, Kauai, this is Mel. There is Kamina rates, $99 weekdays, $109 weekends. Is a Kauai Beach Resort a resort bubble?
I
I,
mean, must
I don't
be.
remember seeing their name on the list. They may have. Yeah, can someone clarify? Is Kauai Beach Resort a resort bubble hotel? Laurie says Luhui Marriott, $271 a night. Mobile doc comes to the hotels for $215 a test. $215 for an antigen test. Charlie, how much does an antigen test cost? Just
Huh?
generally. I know we both did the research. We know we kind of know how much these things cost.
Wait, I'm gonna put you on hold, and I'm gonna do my responsibility. Talk to the crowd while I be right back.
I mean, we've heard these tests running. Yeah, KBR is not yet. So Kauai Beach Resort is not a resort bubble hotel, Francine. So they wouldn't qualify for the resort bubble. You cannot stay at KBR. You can stay at Hilton Garden Inn, the Marriott, um, Kukui'ula Timbers. I think I don't want to misquote. I don't have the list with me. I apologize. I think there's 6 of them though. But yeah, KBR is not one of them yet. Let's see. Yeah, KBR is not. So that's the key is trying to hold on here. Hilton Garden Inn, they offer us $99 combine rate. Okay. Well, that's good. That's good. The Cliffs. All right. Mel, do you know anything about the PUC extension? I'm sorry, I don't. I'm sorry, I don't. Yeah, no, what I was talking about the cost, Nancy, of the test was how much does the actual test cost? Understand you need a doctor to administer to a nurse or whoever, but those tests, they're here. Look, Charlie actually has the line on tests. Okay, here we go. Charlie's gonna do a live demonstration right
Oh
now.
no, no, no. I'm not gonna. But see, when you're talking about the rapid antigen, this is what they're gonna start administering to you. See, it comes with buffer kits, swabs. Um, there's 25 per box. This box is about, I mean, I think this is the one, right here. You put a little bunch of this in, and I think this is what I'm assuming they're charging $215. But if, I cannot mention the line and what you can purchase for, but all I can say is this: hell of a lot cheaper per. That's all
That's
I'm
what
going
I'm
to say.
saying. I mean, we heard from many doctors that use the test
Yeah.
that anywhere from $20 to $40, maybe $50 a test. So I understand supply and demand, and Jesus Christ, people will pay whatever they can to get out of quarantine. So again, just
You know, the,
opportunity.
the only thing you can't buy it is because it is. And I've got the paperwork. Can you see that?
Emergency use authorization only, so you cannot
Yeah.
sell.
So I got the paperwork. I got the paperwork from the FDA. I have it.
Yeah.
So this is a sample run because I wanted to take a look at it, right? Because if if we're racing against the clock, I don't know, if you only get, say for instance, you heard Dr. Miskovich says he's with Quidel, right?
Hmm.
That's one line. Then the other line we know is Abbott, right?
Hmm.
We gotta be looking outside of the parameters, for all the medical professional on the islands. You can't only have a bunch. It's gonna be like a monopoly, and we're in a race against time with places like California, all the states that this thing is blowing up. You know what I mean?
Yeah.
Right? So I think you got to take a look at other acceptable alternatives. But that's why I don't want to break any of the kit. It's because I still have the ability to send it back, which I probably am gonna do. But I just wanted to see, what it looks like, how does it come, and basically it's a kit that looked like, remember the antibody kit that Dr. T used the day we did the test over at KBR.
Hmm.
It looks similar to that. Take a swab in your nose, doesn't have to go deep, can just be on the surface. Put in a capture tube, add 10 drops, shake it for 15 seconds, open the bottom cap, put 2 drops into what looks like a pregnancy test, right? Wait about 5 minutes. The lines line up positive. If they don't line up, negative. Stuff like that. Yeah, that's from what I've been reading. That's what it looks like.
Yeah. Well, there's so many of them now. Yeah. I mean, we've created a whole industry, a whole new, not so much created an industry, but created the just a lot of money, um, being made right now because of the testing and everything else. But that is the key to all of this is keeping people safe and making sure we can identify. And again, going back to CAPA Pediatrics, that kind of notification out to the general public. And I did want to share a story about another friend of mine that had a friend in New York because we know with this new variant that it's very, very contagious, 75% more contagious, some of the estimates from some of the experts. And we still got people that say, yeah, I saw a post, you shouldn't be saying that because that's just what they suspect. Well, listen, first of all, I'm going to listen to the doctor and the experts telling me they've seen it, they've tested it, it's in the UK. It's contagious enough that London just shut down their country. So yes, I'm not the doctor, and I'm not saying it. I'm just repeating what I'm hearing and what the experts are saying. This strain, not this strain, but this variant is much more contagious than the original. So a friend of mine, and I'm gonna have to take my phone down so I want to read it because I don't want to misquote again without mentioning names. It just says my friend in New York City went to a store in New York City. She was sent a letter because she went to the store and someone that went to the store tested positive with the variant. And this is what the letter that she received says. Unfortunately, the Wadsworth Laboratory in Albany has confirmed the first known case of the UK variant of the virus that causes COVID-19 in New York State. An individual from Saratoga County, New York, with no known recent travel, tested positive for the strain, which scientists say is more contagious than the other strains. It is not believed to be deadlier or to cause more severe disease. We are asking anyone who visited North Fox Jewelers in Saratoga Springs, New York between December 18th and December 24th to please get tested as soon as possible. Because the individual who tested positive for this variant did not travel recently, it is likely that the strain is spreading in the community. This was the letter that my friend's friend got in New York because she visited a jewelry store in New York City, and everybody got the notification. Now, the person that tested positive, as I just read, had not traveled. So obviously, that person got this new variant from the community, from someone in the community. So the variant is there. The variant is getting out there. And guess what? How many people you think come to Hawaii from New York? How many direct flights do we have from New York City, from New York to Honolulu? This is my point, that we don't have that kind of information. We don't get that kind of information. And I wish we did. I wish if someone tested positive, that we all would be notified, like Kappa Pediatrics did. That in fact, Charlie has been saying this from day one. That if it happened at Kukui Grove, if it happened at Walmart or wherever, that they come out and say between the dates of December 18th and December 25th, if you had been at the mall, if you had been at Walmart, if you had been at wherever, please get yourself tested because we had a positive case that was community spread. Why is that so hard to do? Well, the Constitution, Constitution. Well, what is New York City or New York State not part of the United States Constitution? You know, that's what frustrates me. It's always about constitutionality, but other states are doing these things, which means it doesn't violate the Constitution because they share the same Constitution as we do. And I just, it blows my mind. Every single excuse in the book, the state gives us why they cannot tell us. Unbelievable. Unbelievable.
Yep.
But you know, we don't want to be like New York. We don't want to be number one in the list. We don't want to have more. I watched the news tonight, Charlie. You know, it breaks my heart when I hear the reporters talking to nurses and doctors. And one of the hospitals they were at on the tonight's news, 300% above capacity. Now, what does that tell you, Charlie? 300% above capacity means, they're, like you mentioned, they're using closets and they're using hallways and they're using areas that are not designed to treat people. They're sending out messages and warnings. Do not bring patients to our hospital. We can't take them no more.
Yeah.
That's what's happening. And is that what we're waiting for in Hawaii? Is that what our state, our governor, and our lieutenant governor is waiting for? For that to happen so we have a reason to shut down? By then it's too late. By then it's too late.
You know what's very very I guess what's very very baffling is, you know, both you and I, we pretty much have the same sources from all islands, right?
Yeah.
And you've been getting reports and I've been getting reports about the numbers that's climbing in our hospitals, but it's not being accurately reflected with the reports that's released daily from the DOH, and that concerns me. That concerns me only because we're under this assumption like, oh no, we're really doing great based on the ground personnel that we have. And unless, you know, unless they're lying to us, which I have no doubt that why would they be doing that? But it's for, and you know, you and I, we vetted this thing several times, and it appears that, yeah, the hospitals are are getting filled up.
It is, and it's
Yeah.
and the level of capacities that are being reached on the mainland is scary. It's scary, and you know, like the guy, the doctor was saying, you know, it's that person that had a heart attack or that person that got into a traffic accident.
Hmm.
They may not have a room to go to. So for those of you that continue to say that this is fake and this is we're sheep and maybe you guys should start paying attention. Maybe you guys should start paying attention to what's really happening. Because it's not happening in our location right now doesn't mean it's not happening. It is happening everywhere. Look at, I mean, for England to shut down the country, I mean, shut down. All, you know, everything is closed. Essential use only. Takeout, restaurant takeouts only. I mean, that's the only way. And while we see, you watch the news, you saw the number of travelers. I forget what, 17 million or whatever travelers in a day this holiday season.
Hmm.
All like they could give a rat's patootie about everybody else. They just was gonna go on their vacation. How many of those 17 million people was carrying the virus? How many of those people shared the virus with someone in that airplane or at the terminal, at the rental car, at the hotel, at the market?
Hmm.
Then we wonder, wow, 241 cases. Yeah, that's just from Christmas. on in Hawaii. Wait till New Year's.
But you saw my post what I said about the virus, right? It's real easy. If the virus can't latch onto you, right? If it
Hmm.
can't latch onto you, where does it go? Does it stay hiding on a surface and just waits until it latches onto somebody after so many days? We know the thing can only last for so long
Hmm.
outside of a host carrier, right?
Right.
So if everybody just understands that concept that you don't come, you stay apart, you wear your mask, you wash out. We should we shouldn't be breathing life into this virus. But when you have
Correct.
these kind of big beach parties and all of that, all you're doing is breathing life. And then guess what, folks? You're gonna hear the same bull crap over and over again about how this virus is starting up again. I mean, I'm pretty sure you're getting sick like me. But if you don't like deal with it, and you like kick the can down the road, you're either gonna deal with it now or you're gonna deal with it down the road. I'd rather just get it out of this damn place. Plain and
Yeah.
simple. Plain and simple.
Just wanted to read a text I just got. Kauai DLS at Kuhio Medical Center started observed nasal swab collection for COVID-19. This line of testing for non-medical use only, which is travel, back to work, or just screening. Also, no doctor's order required. Healthy patient, non-symptomatic only. Don't go there if you're sick. It's an observed nasal swab collection, molecular PCR test, $125. Patients do not need an order from the MD as they have a doctor there that will order the test. Turnaround time is typically 24 to 72 hours. However, it has been a lot quicker. So if you guys are looking, DLS does it here on Kauai if you need it for Kauai. So
Mm.
anyway, yeah, it's I'm just tired of it. I'm tired of it. I'm tired of every day, and then hearing just what I wish we would hear from. And if you think about it, only Derek was the only one that really rang the bell.
Hmm.
Everywhere else, now I see Mike Victorino, Mayor Victorino from Maui. He's starting to do the daily things and giving the actual numbers. But Derek was the only one that rang the bell and reminded people how dangerous this was and how why it was so important for us to stay safe. Hence, our numbers is a lot less.
Hmm.
But even after all this time has passed now, 10 years, I mean, 10 months have passed.
Hmm.
And if you turn on the news and listen to the state, and I'm not talking about Dr. Berman because she's been solid. She's the other one that's been ringing the bell. All you hear is that it's not that bad. It's not that bad. It's not that bad. And I think it gives people that motivation to go out and be unsafe. Uh, and that I think is what's so frustrating. So frustrating.
Well, there's another avenue too that I'm trying to look into, and I sent. I'm waiting for a response to some of our doctors that's been on. And that is, some are saying the second booster shot to the first one that's taken might even be more harsh. And CDC says if you got a bad reaction the first time, do not take the second shot. I mean, it's posted. I read it. I think it was released a couple of days ago, and I just read the thing. I went, ooh, I hope they tell everybody that. You know what I mean? But it doesn't
Well,
tell you. They don't tell you which brand. They just say if you had a severe reaction during the first, do not take the second.
yeah, again, we said this before, and in fact, even Dr. Vong on his podcast or YouTube live today said the same thing. Check with your doctor. That's the only person you should be listening to. You shouldn't be listening to anyone else but your personal doctor, because Dr. Fauci don't know you. No one else knows you and your body and your physical health. You need to have the discussion with your doctor. And I know my sister-in-law. She had the first shot. She's not getting the second one because of a reaction. And a lot of people are getting reactions. But you know what? A lot of people get reactions with flu shots. I had a reaction with my hepatitis vaccine, so I never got the second and the third shot. It is what it is. That's what happens. That's what happens with vaccines. But No one knows you better than you, or should anyway, know you better than your doctor. Based on your health condition, let the doctor tell you or recommend to you what they believe you should do. At the end of the day, it's still your call. But just because Fauci or Wong or whoever, any of these guys you see on CNN tell you you need to go take the vaccine, you need to talk to your doctor. That's what you need to do. And that's that's my suggestion. Of course, I'm not a doctor. Yes, I'm talking about your PCP, your primary care physician, not any doctor. Thanks, Kekea. Exactly what I'm saying. And if you don't have one, you should go get one. I get Dr. King. She's a dream. I love Dr. King. She, you know, she's awesome. But go get a doctor, man, and have the discussion with a doctor because you know, that's the other thing, right? We talked about it earlier in the show. For those of you that came on late, this vaccine isn't going to prevent you from catching the virus or sharing the virus or shedding the virus. It's just going to reduce your the level of illness that you get should you get the virus. And
Mm.
that's the truth. That's what this is. I don't know what qualifies for a vaccine to call it a vaccine because prior to COVID, I thought you get a vaccine, then you're protected. Then your immunities are so strong you don't even get the virus. You can't share the virus. That's what I thought. I was wrong. So with COVID, yeah, you could have the vaccine, and you could be going out catching you, and you won't get sick. You probably won't get sick, and if you do, it'll be such a mild sick that you'll still be able to spread that to other people. And that's the danger. That's the danger.
Can you imagine today? I'm watching the TV and they brought on this noted expert and they asked about the variant, whether the vaccine gonna work. I got so confused. I was ready for getting my rice pot and fling them at my TV. I was pissed off because she says, you know, the vaccine for the virus, the little spikes, and it
Hmm.
attaches itself to the spikes. That's how the
Yeah.
vaccine works, right?
Right.
With this new variant, the spikes that's supposed to be like this are now like this. So there's nothing to grab onto it. And I'm looking at it and what? I said,
Yeah.
if it's not one thing, it's another. So it's almost like you get corn, you give corn on a cob to one guy that no more teeth. What normally would take you 15 minutes to eat the corn on a cob, gonna take you about 4 hours because you're gonna gum that bugger to death. You know what I mean? I'm like, what are you saying?
Oh boy. All right. Wait. Well, switching gears. Tyler Gomes was on the Star Advertiser today on their live interview, and he's a vice chairman of the DHHL, and he was trying to convince the world that this is the only thing on the table for DHHL as far as a sustainable source, and that in fact the study that they read from Harvard um, was surprising. That in fact it's not that dangerous to the social cost isn't that high. And when they asked him which study, he said, "Oh, it was a study back in the early 2010 or 11 or something like that, 20, 10 years ago, 15 years ago, 12 years ago."
Mm-hmm.
But I was shocked to hear that this is all that DHHL has been talking about. There's no other discussions going on regarding sustainability of DHHL for homes and housing for Hawaiians, but it's all about this and that they hadn't spoken to the beneficiaries. They were only now meeting with legislators, but they believe that this is the best course of action and that in fact it's going to generate more than enough money so we can put the Hawaiians in Hawaiian homes. If you didn't watch that, check go back to the Star Advertiser. I think it's on their Facebook page. It's about a half an hour long, but it's kind. This guy is really young. He looks about 12 years old, and he's so excited that they found the golden egg, man, the duck or the whatever, the duck that laid the golden egg or the goose, whatever it was.
Mm-hmm.
It was kind of interesting that he was so, and I could visualize myself early in my political career where the lobbyists would come in and talk to me and tell me how good something was. And there was absolutely no downside. Whatever the lobbyist was lobbying for, when I was brand new, sounded so real and so good, and that it was the right thing to do. But I learned real quick before you go out and tell everybody that this is what we need to do. No, now you go out and you go let the people that are going to be affected know and get their version and their side of the story. And that's what they didn't do until they dropped the bill. And then now that people are upset, it's incredible. You got to watch it because he's like so innocent looking, very naive, I think. And
How old? Who's this? Tyler.
Tyler Gomes, yeah,
And
yeah.
how old is he?
I don't know. He looks about 12, but he's probably, I don't know, I would say early 20s, maybe mid 20s. I don't know.
Any
I
any
actually,
know any know?
Kamehameha Middle School graduate.
No, no. Maybe if they say it wrong, she was a Kamuki. Kamuki
No,
and maybe I sound the same, you know what I mean? Or
it
Campbell.
was, I was reading the comments as the interview was going. I was reading the live comments, and boy, he was not being received well. And brother, they were like, "Hey, brother, as a Kamehameha School alumni, I'm embarrassed." It was, but he's totally convinced. He's totally convinced that one license, and they asked him, so what? That does will this open the door? He goes, we cannot predict the future. He said, we don't know what this, we know that tourism is our most the biggest industry, and who knows, this could be the start of more. I mean, like he was so excited, like, yeah, we want to bring a Vegas here to Eva Beach. Oh my gosh. So yeah, if you haven't seen it, go watch it. I thought it was quite entertaining. I cannot imagine that passing the legislature and the governor, but I've seen some stranger things. So you just gotta wait and see.
Yes, yes, Matt. Kamehameha Law Campus is Farrington. Yep. And the only way we know that is I have a lot of friends that went to Farrington. Sad, but when there's heavy rains, I could only see the top of the cafeteria, the roof. The rest was underwater. Yep, that's Farrington. Lower campus, Kapalama. Um, but again, folks, I think, we're discussing now about the Hawaiians. And, I really think they should have asked how they felt, or even a study done, ask how many Hawaiians, how many times you've been to Vegas? You answer correctly. Not correctly, but you answer honestly, right? And you say 6 times. And how many times you won any kind of jackpots? And you put down none. How do you feel about the casino? And you're going to answer like absolutely not.
Yeah.
But if you say 5 out of 6, you will get answers like absolutely yes. It stands to reason, right? It stands to reason. So
Some of the guys were saying, yeah, I fully support a casino, just not in Eva Beach. Christine is asking if we heard about the new variant that's even more infectious than the one that's in New York
the one from
and
South Africa.
and San Diego that's in South Africa. Oh yeah, yeah,
Yeah,
yeah,
South Africa.
yeah. Hey, so anyway, we'll go back to Feel Good Fridays on Friday, Charlie. We'll grab some local businesses,
I
share
want to I
again.
want to get some, tell, folks who watch it, if you're on other islands, get us names of some businesses on your island. You know, um, Big Island, Maui. You know, let's get some other places that somebody even brought on. We should bring somebody on from title companies because some people losing properties and before we even go there, I would bring on somebody like Lou Baker to actually give us the rundown financially where we're gonna be in the next couple of years because when you need those kind of guys with that experience, right?
Hmm.
He's been pretty much on the mark in the years past. He's kind of he's kind of felt the pulse and where we were going. So I think I think what we should do is we should bring somebody like that.
Yeah, whatever you guys want to see, man. We're game. We're game. Today we just had enough to talk about between Charlie and I, just with the developments that's been going on. And as you can imagine, a lot of our guests are busy people. Everybody's worried about what will tomorrow bring. I mean, what will tomorrow bring? We wake up in the morning, how many more different uh, things will have happened? I think that's what it is. I mean, I get up in the morning, I run to my phone and I check my headline just to see what happened. Because of the time difference, it's already daytime on the East Coast, and it's a horrible way to live, looking for what's going on elsewhere. But regardless of what happens next, regardless of what this variant does, the fact that we are still here on Kauai, we're still in this state on each of our islands, and we always got to take care of each other. We gotta, and that's how we came up with the Feel Good Friday. Was we'll get some local businesses on, give them a few minutes to share what they're doing, where they're located, and what how they can help you guys, and if there's any combine on discounts, any of that stuff. But we really want to focus on on taking care of each other, taking care of each other. And today Patsy made we ate in. Of course, we had Patsy made some enchiladas with our Verdi tortillas. Delicious stuff. So we tried our best to support local.
Hmm.
And there's a lot of places that we haven't heard about. We haven't heard about, and we want to share them with all of you. So yeah, if you know anyone, or if you yourself are a business owner, let us know. Let us know. We definitely want to get you guys on.
And it doesn't have to be a eatery. It can be a clothing shop. It can be a business that you provide business for others. It can be landscaping. Anything.
Yeah.
We just want to get the word out so we can help in any way possible, because it ain't an easy road. Let me tell you, it's tough, and I get sad seeing you know seeing all this kind of things happening. Um, some people had the foresight to really put away for a rainy day, but that the end of that is coming to an end as well. And some were just living paycheck to paycheck just to make ends meet. And someone had asked, and I'm gonna be straight up, why Hawaii is so expensive. One, we live in the damn middle of the ocean. What do you expect? We don't have the ability like the mainland, where trucking is a big industry. One of our good friends from Kauai packed up and left and is a trucker on the mainland now. So they got goods coming in on that. They got rail. They got they got all of that. They have,
Train. You
yeah,
you meant train.
yeah, rail. No, not yeah, yeah, train. Oh, they, they have the
Because if they
ability
had
to,
if they had rail, Charlie, would prices would be higher than Hawaii if they had
yeah,
our rail.
yeah. So you have all of this. You have that ability, but here, when you only have ship and boat, it's tough. It's a tough thing, and you know, it, there's only so much you can do. But I can tell you one thing. I've seen it. I've got the friends that move from Hawaii to the mainland. They find it easy to survive because they survived in Hawaii, and they tuned their way of living from Hawaii to the mainland style. So they have this this abundance because they live within their means, right?
Hmm.
But then sometimes, and you don't blame, you've been busting your collie for 40 plus years. You want to be with the Joneses. So you buy something that really can afford, but you're gonna go for it anyway because at the moment in time you have the ability to do it. Then you just gotta wait and see what the backlash gonna be if the well runs dry, and that's the only thing. That's the only.
I know that we a lot of businesses that depend on the local, that depended on the visitor industry now gotta rely on the local. So
Hmm. Yeah.
Let's go help them out, man. Let's go help them out. If if you cannot get it locally, then yeah, Walmart or Costco or whatever. But if you can get it locally, get it locally. Farmers and farmers market, Saturday craft. Sunshine Market at Puhi Park is an amazing place to go shop. Pretty cool stuff over there. So anyway, what else you got, Charles? Any closing comments, buddy?
Well, I appreciate all you do, Mel. I know I don't thank you enough. I know you're a busy guy during the daytime. I call you like about, well, I know what you do, but I do call you about 15 times, and I don't get one response. So I must be dialing one wrong digit, or no. But I just wanted to say thanks. I wanted to say thanks to everybody out there. You know, it's never easy coming on. I guess we make it look easy that we come on and we talk story and we shoot the bull, and hopefully we can spur a discussion to get everybody actively involved. But folks, based on the comments I see and based on the viewers, I know you folks are actively involved already. I know you are actively involved, and I guess what I'm saying is, I just need your help to kind of like help us see things in many different angles of how we can help the rest of our communities, no matter what island we're on. And hopefully, we can succeed and be successful. I know right now the big thing is the vaccine. I have taken it, and I took it on the 29th, and today is what, the 4th. So there's about 6 days now, I believe, between. I haven't had any reactions yet, but who knows? I haven't had the sore arm. I'm very fortunate. Um, and I wish, those who want to take it, I wish everybody can get it. I don't know why there is a delay. I know New York made a big push and they're pushing hard. They're pushing hard. You look at their vaccination rate there. You look at the UK. You look at places like Israel and every place else under the sun. For some reason, all we're doing is we're not talking about vaccination enough. We're talking about elections and all of that stuff going on still yet. So, I mean, it's there's just so many things going on. I wish we prioritize and take care of lives first. That's all that matters to me. I'm saying that too. I want to send out my condolences to a brother in Florida who's from Hawaii, retired fire captain on Maui, the classmate of my brother, and we just found out his son, who was security in Vegas, in his 40s, just passed away from COVID day before yesterday,
Oh,
and his I believe his 9-week-old daughter also has COVID. Brand new
oh,
baby girl. She has COVID. So and they live in Vegas. So I don't know the full circumstances. Just my heart goes out to my brother's classmate and a good brother to me when I was growing up. I was a water boy for the football team. He was always there, you know, taking good care of me in the bus and all that. Especially when we went down to Kahuku, because I never know who was going to throw rocks at us or not. But condolences to his family. So for me, again, it's another personal friend that lost a life, or I know family friend that their family lost a life to COVID, and it doesn't look like it's stopping anytime soon. So, what I said earlier, if we can take the life out of it, then we have fighting chance. But these knuckleheads, if they want to dabble in thinking that this is fake, or they can gather and they're not going to get it because everybody seems okay, nobody's showing symptoms, well, then you're going to be pleasantly surprised. You're going to be pleasantly surprised. Okay, brother?
well, sorry to hear about your buddy, man. I didn't know. Sorry about that, bro. It's yeah, it's more and more people. We get messages throughout the day from again our Ohana that we've never met from the show that have had either friends or relatives pass away with COVID on the mainland. So It's real, and it's here, and we got to be safe. We got to think about others. We got to respect others, even if you don't respect yourself. Respect others. All right, and wear your mask and social distance. Stop the parties and the congregations. I saw way too many pictures this weekend of a lot of my friends just hanging out close, shoulder to shoulder, no more mask. Guys, we gotta be smarter than that. We gotta be smarter. And prayers for all of those that have had losses in their families over this COVID nonsense. So anyway, with that, guys, thank you for joining us again. We'll be back tomorrow night at 7 o'clock. We appreciate you guys. We love you guys. Take care. God bless. And until tomorrow, aloha.